So there's also some important safeguards to consider when implementing the study. One being parental consent. Since we are working with children, obtaining parental consent is a necessary requirement. Children must express a willingness to participate and must also have parent-guardian consent for participation, and parents must be presented with enough information on the study to provide informed consent. HIPAA compliance and data security. If any data regarding psychiatric diagnoses are incorporated into the study, it's likely that HIPAA compliance will be a concern. The Health Insurance Portability and Accountability Act establishes safeguards for patients' confidentiality of health information. This could include psychiatric diagnoses or treatment provided for such. Our study would need to take appropriate measures to ensure that protected health information is not inadvertently released to anyone who does not have the authorization to view it. We would also have to get written consents for viewing this information. Any handling of electronic medical records would be subject to HIPAA compliance standards. Data collection during the study should also be taken care to be de-identified to the extent possible to avoid inadvertent dissemination of identifiable data, and participants and guardians will need to sign a data sharing and use agreement which adequately informs them of the risks associated with data collection and how the individual data may be used. The risk of re-traumatization is an important consideration in providing trauma-informed care, and implementing trauma-informed practices can reduce the incidence of re-traumatization. Investigators may benefit from training in trauma-informed care prior to the implementation of the study. Investigators should be able to recognize the 4 R's of trauma-informed care: realize, recognize, respond, and resist. Investigators should be able to realize how trauma has impacted the individual, recognize symptoms, respond in trauma-informed methods, and resist re-traumatization in their dealings with participants. Limitations associated with this study may be recall bias with the data. Individuals may not remember events accurately, which may lead either to overestimates or underestimates of bullying behavior and severity. A simulated stressful event negatively affected the ability of individuals to recall specific aspects of a stressful event in an experiment designed to test their recall ability. Therefore, recall of stressful events, such as those associated with PTSD, may be even more limited than what is typically expected.